Hello and welcome to another live stream of Dr. Barbara Miller Comprehensive NCLEX Review. Today, the topic is on anemia. Okay, so what is anemia? Anemia is a condition in which the number of red blood cells gets very low. Blood cannot get enough oxygenation, and that impacts negatively on the person who is experiencing anemia. You do have several types of anemia, and we're going to go through each, but there are many factors that contributing to anemia. For example, the patient could have an acute or chronic blood loss from the gastrointestinal bleeding. Patient may have an ulcer. Also, the patient could have a greater than normal destruction of the red blood cells, some type of spleen diseases. Patient could also have abnormal bone marrow function that caused from chemotherapeutic agent. Patient has some cancer and receiving chemotherapy. It also causes from decrease in erythropoietin when someone is going through renal failure or kidney failure. And it could be an inadequate maturation, okay, possible red blood cells, cancer, or nutritional deficiencies from iron, B12, folic acid, intrinsic factors. So let's get into the types of anemia. So you have anemia secondary, as mentioned before, to renal disease or renal failure, where the patient anemia due to lack of erythropoietin. And what is an erythropoietin? It's a glycoprotein hormone that regulates the red blood cells production. So patient who going through renal failure, you want to look for that in their labs. So they would give medication, erythropoietin, to help with the lack of erythropoietin. Then the next type of anemia is iron deficiency anemia. The body lacks sufficient iron. And what are the contributing factors to iron deficiency anemia? It also could be a chronic blood loss, bleeding ulcers, patient bleeding from the gastrointestinal system. It could also be nutritional deficiency. This type of anemia is prevalent in infant, older adults, and young adults, adult women, due to pregnancy or their menstruations. What are the manifestations of iron deficiency anemia? Microcystic red blood cells. Patient will have weaknesses and pallor. Patient will have a low serum ferritin levels. And what's a ferritin? A ferritin is a protein that stores iron in the body. They will need lots of collaborative care, more so when they're pregnant at a young age, okay? So you want to monitor for symptoms of bleeding. You want to monitor their labs, such as their complete blood count, their serum iron test, okay? You want to ensure that they get their medications, administer iron preparation, okay? You want to ensure that when the patient is taking their iron, they should not take the iron with milk. They want to take iron with water. Water helps to enhance the absorption. Okay, therapeutic measures, you want to have them follow their provider prescription for ulcer treatment if they have ulcers. The next type of anemia is aplastic anemia, and this is a serious uh, 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 anemia where the bone marrow fails to produce enough new blood cells. So, what are the clinical manifestations of aplastic anemia? Hypoxia. Hypoxia is decrease in the oxygen in the tissues. Patient becomes fatigued. They have pallor related to the anemia. They have increased susceptibility to infection. They're more prone to infection related to leukopenia, drop in the white blood cells. They can have hemorrhage. They have ecchymosis and petechiae related to thrombocytopenia. So what is thrombocytopenia? Low platelet count. The normal platelet count is 150 to 420,000. They also will have pancytopenia. And what is that? This is a decrease in the red blood cells, the white blood cells, and the platelets. Patient with aplastic anemia, they need lots of collaborative care. Okay, for nursing, you want to instruct the nurses to monitor labs, provide protective isolation. You want to have them monitor for manifestation of infection, look at their white blood count to see if there's any elevation, whether they're running a temperature or not. You want to provide emotional and psychological support to these patients. Implement protective barrier precautions and prepare client for bone marrow aspiration and biopsy. The medication that they administered for aplastic anemia is immunosuppressive therapy, such as prednisone and cyclosporin. They also will administer in a low dose chemotherapeutic medications. The therapeutic measure is hematopoietic stem cells transplantation for patients with aplastic anemia. They also will have splenectomy. Remember, when the patient has a splenectomy, they become a spleen. A spleen, a patient without a spleen, they need to take their pneumococcal vaccine every 5 years or so to prevent or reduce the risk factors of pneumonia. So with this, you want a cautious use of blood transfusion with aplastic anemia. The next type of anemia is B12 deficiency, also known as macrocytic. This type of anemia, the patient lacks the intrinsic factor, and they do not or they cannot absorb vitamin B12 by eating the foods. Okay, so what are the contributing factors for B12 deficiency? They have atrophy of the gastric mucosa, okay, by the stomach. They also can have total gastrectomy. Total gastrectomy, they will lack the intrinsic factor and decrease intestinal vitamin B12 absorption. So no matter how much food they consume with vitamin B12, they cannot absorb those. So, what are the clinical manifestations of B12 deficiency anemia? Patient will experience numbness and tingling of the extremities, paresthesia. They also will have hypoxemia, decreased oxygenation in the blood. They will have pallor. They become jaundice. If you look at the sclera will show yellow, yellowish. They will also have glossitis, okay, inflammation or infection of the tongue. They have poor balance. So, how do they diagnose B12 deficiency? Don't forget, they utilize the Schilling test. S as in Sam, H as in Harry, I as in image, L as in Larry, L as in Larry, I as in image, N as in Nancy, G as in good. The Schilling test is used to differentiate malabsorption versus pernicious anemia by measuring absorption of B12 with and without the intrinsic factor after the client is given an oral dose of radioactive vitamin B12. They also use the complete blood count, megablastic red blood cells, or microcytic. They will need lots of collaborative care. You want to ensure that the labs are being monitored for patient with B12 deficiency and the Medicare, and also stress the importance of rest period and encourage a balanced dietary intake. The medications that they will utilize or administer for B12 deficiency is that of syncobalamine, vitamin B12 IM, 1,000 microgram intramuscularly daily for 2 weeks, then weekly until the hematocrit level is therapeutic, then monthly for life. Let me repeat. Vitamin B12, the standard dose is 1,000 microgram IM daily for 2 weeks, then weekly until the hematocrit level is therapeutic, then monthly for life. Syncobalamine also given intranasally to maintain vitamin B12 levels. The next type of anemia is that of folic acid. Folic acid is due to deficiency. It's similar to that of vitamin B12 deficiency, but the nervous system function remain normal. So what are the contributing factors? Poor nutrition, malabsorption, secondary to Crohn's disease. Remember, Crohn's disease affects the mouth to the anus. The drugs that drugs, for example, chronic alcohol abuse, okay, anticonvulsants, and oral contraceptive. These are the contributing factors to folic acid. Again, patient with folic acid or anemia, they will also need lots of collaborative care. Okay, the nursing intervention, you want to identify the risk, okay, the client is experiencing, whether the client is alcoholic, elderly, debilitated client. Medication that they use is folic acid replacement. Remember, if you were to ask, folic acid is a great source, okay? It combat or reduce risk factors of neural tube defects such as spina bifida, hydrocephalus, encephaly, those type of neural tube defect. Another type of anemia is hemolytic and aplastic anemia, which is a group of anemia that occurs when the bone marrow is unable to increase production to make up for the premature destruction of the red blood cells. What are the contributing factors? Trauma. Patient experience trauma, a crushing injury. It could be from a motor vehicle accident, lead poisoning, tuberculosis, and that's a respiratory condition, although they have another type of tuberculosis called miliary, where it disseminates through the bloodstream. Infection, transfusion reactions, toxic agent, radiation exposure. These are the main contributing factors to hemolytic and aplastic anemia. So, what are some clinical manifestations or signs and symptoms? Patient will experience chills. Patient will have dark urine, so you want to monitor the urine. You want to palpate the spleen. The patient will have enlarged spleen. Okay. Patient will have rapid heart rate, tachycardia. Patient also will have shortness of breath and jaundice. So again, you want to look at the patient's eyes, the sclera, and you will see changes in the sclera. The darker skin, you want to look at the roof of the mouth, and you will see changes up in the roof of the mouth. Again, these patients need lots of collaborative care. You want to treat the underlying cause. Hydration is paramount. You want to ensure that your patient is getting adequate fluid intake, blood transfusion when kidney function is normal. So, what are the medications that they use for hemolytic and aplastic anemia? In severe immune-related hemolytic anemia, they will use steroid therapy. It is sometimes necessary. They will use hematopoietic stem cell, hematopoietic stem cell transplantation for aplastic anemia if other treatment fails. Now we at sickle cell anemia. Sickle cell has genetic component. Okay, it affects African American or Mediterranean origin. Okay, people from that part of the world. So, what are the contributing factors? Before we get there, sickle cell, the red blood cell should be nicely round. However, with sickle cell, the cell is as a crescent shape, which prevents oxygenation from going through that cells readily. So, what are the contributing factors that could cause a crisis? Stress. Stress is a major contributor to a whole host of illnesses, just as sickle cell anemia, dehydration, hypoxia, high altitude. Okay, whenever they take like plane rides, they become very ill, shortness of breath, uh, pain. They're also at risk uh, for infection, or one of the contributors, infection. So the clinical manifestations for sickle cell anemia, patient will have severe pain and swelling. And why? It occurs when the sickled shaped cells blocks the blood flow to the organ and tissues. Patients start getting swelling in the hands and the feet, known as dactylitis. Dactylitis, swelling of the hands and feet. Patient is also at risk for jaundice, fever. They are susceptible to infection. They become hypoxic, that damage to the organs, the spleen, the liver, the heart, the kidney, and the brain. Be mindful, you may be asked on one of your questions, know that two-parent, okay, who carry the trait, there's a 25% chance that they may produce an offspring, a child with a full-blown sickle cell. Don't forget that. And how do they diagnose sickle cell? The percentage of hemoglobin, or the HGBS, seen on electrophoresis. Sickle cell trait has less than 40 hemoglobin, and sickle cell disease may have 80 to 100% of hemoglobin S. Patient with sickle cell needs lots of collaborative care. They suffer a whole lot. They come in with abdominal pain. You want to treat them. You want to administer some analgesics, okay, to help them. So nursing intervention, you want to maintain adequate hydration. You want to provide oxygen therapy to the client. You also want to encourage the client to rest. Rest is paramount, and avoid a high altitude, alcohol, and temperature extreme. You also want to teach the client to identify the triggers. If you know what the triggers are, then you will try to avoid those triggers. Okay? And to get their immunization in a timely manner. For example, their flu shot and whatever else immunization necessary to keep them from a flare. Also, they would need genetic counseling. And why? Because their offspring, there's a chance of giving their offspring sickle cell. Okay, two-parent, okay, with the trait can produce an offspring, a 25% chance of producing an offspring with a full-blown sickle cell. Medications for sickle cell: morphine sulfate or hydromorphone to manage the client's pain. Remember, before you administer morphine, you want to check the respiratory status and chart it. Because remember, one of the side effects of morphine, it depresses the respiratory status. Other medication, such as hydroxyurea, to reduce the amount of sickling and number of painful episodes that patient may experience. And last but not least is thalassemia. It is also has genetic component. It's an inherited blood disorder in which the body makes an abnormal form of hemoglobin, resulting in excessive destruction of the red blood cells, which leads to anemia. So, hemoglobin, the protein in the red blood cell that carries oxygen. What are the contributing factors that thalassemia patient goes through? They must inherit the defective genes from both parents to develop thalassemia major. They must inherit the defective genes from both parents. And who gets it? Asian, people from Mediterranean and African ethnicity. Other people do get it, but it's more prevalent in these culture. Asian, Mediterranean, or African. Family history of the disorder, because it has genetic component. It's embedded in the DNA. What are the manifestations developed during the first year of life? Bone deformities, you will see in the face. Patient is fatigued. Patient has growth failure, not able to thrive. Patient will have dyspnea, shortness of breath. If you look at their skin, it's yellow, okay? And how do they diagnose thalassemia? Red blood cells appear small and abnormal shape. They will do a complete blood count to reveal the anemia. They will do hemoglobin erythrophoresis, shows the presence of abnormal hemoglobin, and also multiple analysis that detects alpha thalassemia that cannot be seen with hemoglobin erythropoiesis. They do need lots of collaborative care. It is so important. You want to encourage the patient to increase their folate in the diet by including dark green leafy vegetables, dry beans and peas, legumes, and citrus fruits and juices. Administer blood transfusion. You want to encourage rest. Rest is paramount. It helps build the tissues. It provide genetic counseling for these patients. So what are the therapeutic measures? Treatment often involves regular blood transfusion. Okay, so client receiving blood transfusion should not take iron supplements, as this cause high iron levels in the blood. They also will do the chelation therapy may necessary to remove excess iron from the blood, or bone marrow transplant may help to treat the disease. What are the medication? Folic acid. So folic acid plays many roles. It is good for anemia. It is good to lower risk factors for neural tube defects. And thank you. And this is all on anemia. Please journal your notes. When you journal your notes, you tend to remember content on your NCLEX test is paramount. Once you know your content, no matter what form the question comes, if it's a case study, if it's a multiple uh, or select all that applies, rather, multiple choice questions, any form, drag or drop, you should know what to do when you know the content. Okay, and you could also go over strategies, but content is paramount. Thank you for watching. Hope this is beneficial to you in your success on your licensure examination. Are there any questions? Any questions? Tomorrow we'll talk about types of dialysis, which is so important for you to know before you go for your State Board of Nursing examination. No question at all? Okay, thank you for watching. I'm going to end the live stream now. And if you do have questions, you could send them under the community text. Okay, and I will reply to you. Thank you so much and see you, and thanks for joining. Bye now.